Acute inflammation can be described as the early response of tissue to injury. It is a non-specific response which may be evoked by injuries such as small, non-lethal wounds to the skin and bacterial infections. Examples include appendicitis and tonsillitis. When inflammation lasts longer than 6 months, it is called chronic inflammation. Examples are rheumatoid arthritis and multiple sclerosis. Causes of acute inflammation include low-grade bacterial, viral, or fungal infections in the bloodstream and organs, low-grade food allergies, stress, diet, and lifestyle. Chronic inflammation is caused by the failure to eliminate what caused acute inflammation or an autoimmune response. The 5 main symptoms of inflammation, as outlined by this image, are heat, redness, swelling, pain, and loss of function. In acute inflammation, stimuli, such infections or tissue necrosis, result in the recruitment of helper immune cells to the damaged site. The primary cells involved are neutrophils, basophils, and macrophages. These cells work to eliminate the stimulus that caused inflammation. Chronic inflammation occurs from an ongoing stimulus. This can happen when an injury or infection is persistent and the immune cells cannot remove the stimulus. More immune cells are recruited to try to eliminate the stimulus, which increases the inflammation and can damage cells. This continuous increase in inflammation leads to chronic diseases. Acute inflammation can be beneficial, as it is the body's method of indicating the activation of immune response, thereby preventing the spread of infection and repairing damaged tissues. However, too much fluid accumulation creates pressure on the surrounding tissues, which causes pressure on the nerves that results in pain. If acute inflammation is not resolved, it can lead to chronic inflammation. Chronic inflammation, however, has no benefits. It results in inflammatory disorders such as psoriasis and can bring about sepsis, a systematic response to infection which can lead to septic shock. Macrophages, which are present during chronic inflammation, are responsible for tissue injury. Treatments for acute inflammation. NSAIDs counteract the cyclooxygenase enzyme, which synthesizes prostaglandins, which create inflammation. If prostaglandin synthesis can be blocked, inflammation and pain is either eliminated or reduced. Examples include aspirin and ibuprofen. Acetaminophen paracetamol can reduce pain associated with inflammation, have no anti-inflammatory effect, ideal for treating just pain and not inflammation. Treatments for chronic inflammation. Studies have shown that yoga and other forms of exercise can reduce chronic inflammation, pains, and aches. Foods like ginger and turmeric have been used for many years to relieve long-term inflammatory discomfort. Studies in Ohio State University report that daily intake of omega-3 reduced both inflammation and anxiety in groups of young people. Furthermore, cannabis contains a cannabinoid called cannabichromene, which has been shown to have anti-inflammatory properties. Research: multiple sclerosis. Multiple sclerosis is a chronic inflammatory disease, and a lot of research is being done into treatments. It is a T-cell mediated autoimmune disease. Research into chemokines involved with the migration of T helper cells are targeted as a possible therapeutic treatment. The main driver of CNS inflammation are B cells and antibodies. Targeting these cells could lead to the generation of different therapeutic and MS prognosis. Finally, a genetic mutation in a gene coding for a nuclear receptor, NR1H3, can cause MS if triggered by acute inflammation.